Do you have a bowel movement every 2 to 3 days, maybe once a week? It could be the result of a low fiber diet. My name is Marcia Roy Madison. I'm going to explain to you what happens when you consume a low fiber diet. So I'm not going to talk about celiac disease, Crohn's disease, irritable bowel disease, or gluten allergies that can irritate the stomach. I'm just going to talk about the basic complaints that I hear in the clinic, the constipation, the appendicitis, and those type of things. But let's start by walking through what's going on in the colon. How does the colon actually work? Why these issues occur. Okay. So first, when you eat, food goes down into the stomach, and then it makes its way into the small intestine where all the blood vessels are. This is where all the nutrients are pulled out of the food to go into the bloodstream to be taken to the cells. So that's where all the nutrients are. Then what's left in the stomach, in the small intestine, goes into the colon. Right here is the appendix. What happens is, with constipation, as this food goes through the colon, water is being pulled out of the colon in order to resupply your tears, your urine, your saliva. So this is why the stool begins to get hard as it's moving through the large intestine. Food is in the stomach for somewhere between 2 to 6 hours. But it's in the colon for 36 to 72 hours. 36 to 72 hours, which is enough time to pull all of this fluid to recycle for your urine and your tears and your saliva. And as it moves through, it gets hard. And this is how you end up developing constipation. Patients may say, if I ask the patient, do you poop every day? Do you poop every other day? Do you poop every 3 days? And they might say, yeah, I poop every 2 to 3 days to once a week. Or even if they say, I poop every day, they are usually just clearing what's in the rectum, but they are not actually clearing what's going on throughout the colon. So as this poop accumulates in the colon and you're still eating every day, now patients start to complain of pain down in the right lower quadrant because poop is starting to get caught up down into that appendix. Poop is getting down into the appendix because it can't go up because there's a blockage, so poop starts to accumulate down in the appendix. Now, this doesn't happen overnight. This can actually take years, right? The poop gets hard, and then the appendix begins to get inflamed. And this is how you end up with appendicitis. So when patients tell me that they've had appendicitis, I automatically know that they've had some issues with constipation, because constipation leads to appendicitis. Now, in this country, we take the appendix out if it's really inflamed, but some countries, they treat it with antibiotics. The next thing that happens besides constipation is diverticulitis. Each one of these curvatures, the colon is a muscle. The colon is a muscle. It contracts to move the poop through. So a lot of times when kids come into the clinic and they say, oh, I woke up in the middle of the night, my stomach was hurting, that's because the colon is trying to contract to push that hard stool through. So most kids tend to have belly pain during the night. Well, what happens as the colon is trying to push that poop over years, this is when you get older, you start seeing these curvatures. They get loose and flabby. And each one of these are called a diverticuli. Okay. And what happens is poop starts to get caught in hair. right? And some people say, oh, well, my doctor told me not to eat sunflower seeds because I have diverticulitis. Well, it's because the sunflower seeds can get caught in there. It doesn't mean that the sunflower seeds cause the problem. They'll say, oh, I'm not allowed to eat popcorn. Well, that's because it can get caught in there, but it didn't cause the problem. So diverticuli is when the musculature has been pushing and squeezing, almost like when you take a balloon, you squeeze the balloon in the middle and the ends pouch out. That's what causes diverticulitis. The colon is trying to contract and the muscles are getting weak and flabby, and the diverticuli, they become inflamed. So when they become inflamed, that's when we call it diverticulitis. Again, constipation, chronic constipation drives diverticulitis and appendicitis. So we say appendicitis is on the right side of the stomach. Diverticulitis is basically the exact same thing on the left side of the stomach. So either in the left lower quadrant or the left upper quadrant, but it's usually on the left side. Now, after having diverticulitis, what sometimes happens is you start to get a mucousy stool. So patients will start to complain about diarrhea, a mucousy diarrhea. Let's do this, mucousy. A mucousy diarrhea because the diverticuli are creating a mucus to try to soothe the irritation from the constipation. So they start getting like a diarrhea, a mucousy diarrhea, and there's a lot of stomach pain involved with that too. Well, as this continues, and again, we call that diverticulitis, so now it changes with the itis word on the end, just like appendicitis, we put that itis word on the end because now it's inflamed. The next thing that happens is that you start to develop these polyps. You start to develop little polyps in there. So this is the colon polyps from friction rub. If I were to take my hands, if I rub my hands together like this, I can develop calluses on my hands. So likewise, as that hard stool is moving through the colon, it's creating a friction rub in the colon, damaging the walls of the colon. The colon is just like the inside of your mouth. It's soft mucous membrane. If I took a handful of pebbles or rocks and threw them in my mouth and I just kind of went, for 24 hours, it's going to be so excoriated in my mouth. So just imagine that hard stool moving through the colon week after week, year after year. It's just constant irritation, decade after decade. And this is why we start seeing this by the time you're in your 40s and 50s, because you've had 40 years of irritation in the colon. So those polyps, we do the colonoscopy, and the doctor may cut these out for you, but they do grow back because you really haven't changed the diet. And yes, they are considered pre-cancer cells. They do turn cancerous. So if you don't change the diet and start consuming more fiber, now we're developing colon cancer. Now, let me use a different color. Now we've got colon cancer going on. And this is how colon cancer is developed. I know there are some predispositions with family and those different things, but honestly, it really does start from constipation. There's a physician by the name of Michael Greger who talks a lot about nutrition, and Dr. Clapper who talks a lot about the GI system. So you could follow Dr. Michael Greger or Dr. Michael Clapper on YouTube, and they will give you all the information you need. Actually, Dr. Clapper has a great DVD on the digestive system. It's called The Digestive System Made Easy, and he could walk you through this whole thing. The other thing that happens, moving on from colon cancer, constipation also leads to hemorrhoids. So there's a hemorrhoidal, they call it a hemorrhoid plexus. There are a lot of blood vessels in the rectum. And as you're pushing, think of a balloon. When you blow up that balloon, these blood vessels get really engorged, and then sometimes they start coming out. And this is when you have the external hemorrhoids, or you can have the internal hemorrhoids from all the pushing, trying to push this hard stool through. So this is how hemorrhoids are developed from chronic constipation. The next thing that we have linked to constipation are varicose veins. We see women with those big, men with those big rope-looking veins in the leg. There has been some links to constipation and varicose veins. There's also been links to constipation and varicocele. This is when men get swollen blood vessels in their testicles, So if a man says, I have varicocele and they also have hemorrhoids, they probably have constipation. If a person has varicose veins in the leg and they have hemorrhoids, they probably have constipation. Now, I know that hemorrhoids can also come from heavy lifting, and with women, it can come from childbirth, but in all situations, they're engorging those blood vessels. I hope this video was helpful. Please share with anyone who you think it may benefit. Thank you for taking the time to listen to this video.